Hello. Hello.
Hello.
Good,
Hello.
yeah, good evening.
Good evening.
How are you?
We are fine here.
Okay, so now, today we are going to deal with two topics. So let's hurry up. We need
Okay.
to, So let's start with critical thinking. Critical thinking. What is critical thinking? So there are many definitions to critical thinking. So an early definition proposed by Watson and Glaser. This describe critical thinking as what? The combination of abilities needed to define a problem, recognize stated and unstated assumptions, formulate and select hypotheses, draw conclusions, and judge the validity of inferences. Fasciani also says that critical thinking is what? Purposeful, autonomous judgments that lead to what? Interpretation, analysis, inferences, evaluation, and explanation. So as nurses, critical thinking, also described by Bandman and Badman, the rational examination of ideas, inferences, assumptions, principles, arguments, conclusions, issues, beliefs, and actions. And we need this as nurses. We always need to think critically during emergency situations, patient critical care, and wherever we find ourselves. We need this critical thinking. It's very necessary. And functions in critical thinking. So Batman also identified the following functions. So with critical thinking, is a discriminating among the use and misuse of what language. Yeah. Analyzing the meaning of terms. That is critical thinking. Formulating nursing problems is a critical thinking. Analyzing arguments and issues into premises and conclusions. Examine nursing assumptions. Formulating and clarifying value judgments. Seeking reasons, criteria, and principles that justify value judgments. Evaluating the soundness of conclusion. That is critical thinking. So these are the characteristics of critical thinking. It involves conceptualizing. It's a concept, yes. It's rational and reasonable. It's reflective. It is partially attitudinal. It is autonomous. It includes fair judgments and creativity, and is focused on what to believe and true. That is critical thinking. These are the components. So in the component, the critical thinking model for nursing judgment has several components. You have to use your brain. So mental operation. And you need specific knowledge as a nursing, midwifery, and whatever. And you also need experience, yes. And you also have to be competent. And the attitude is very important. Then you also have to follow the standards of care. So the major component of what critical thinking in nursing. So the critical thinking model for nurses, mental, you need to use your brain to work very fast in solving critical issues. You need to have a specific body of knowledge as you are doing in nursing, midwifery, whatever, all other aspect of what nursing. Then your experiences is also very important, necessary here. Then your competencies, your attitude, and standard of care. So we have the 3 levels of critical thinking. You have the basic level where everybody can use it. Then from basic, then you are moving to the complex issues. Then after the complex, you have to be committed to the issues, the complex issues that we have. So with the basic level, the nurse views answers as dichotomous and assumes that authorities have a correct answers for every problem. That is the basic thing that you need to know. So there's also acceptance that there is what? a diversity of opinions and values among authority. Yes, everybody can share his opinion, their values, and everything. But although the goal is to move to higher levels, so basically everybody has to possess this. You need that. Have answer is the goal is to move towards the higher levels of what thinking. Moving can be what restricted by lack of what your knowledge. At the basic level, everybody has supposed to have the basic knowledge. But moving up, moving forward, yes, you need to what have the basis first before you move towards the complex situation. So there's always acceptance that there's what a diversity of opinion, that is the autonomous, and values among what authorities. Mhm. So as I said, you can be restricted by what as you are moving forward. You can be restricted by what if you don't have the knowledge, the experience, as well as by what inadequate competencies, as we saw in the what the 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 the, the major components, as we saw in the basic level. These are the basic level, the major components. So knowledge, you need to have inner knowledge, competencies, appropriate attitudes, and utilization of force. So now utilization of all this. Then at the complex level, the nurse continues to recognize diversity outlooks and perceptions, and also has for the ability to what systematically you detach yourself so that you can answer questions by your own, analyze and examine alternatives by your own as you move forward. Here, the best answer to a problem might be what? It depends. That is alternative behavior, perhaps conflicting solutions are what recognized. So an example of what complex thinking is what deciding to deviate from standard protocols or rules in a specific what complex client situation. Then you need to what think fast. Sometimes in an emergency situation, you also need to what move them from the basic level to the higher levels. So that is why everybody needs what knowledge. So sometimes we have the knowledge, but we need more. That is why we go to school, we go to get more knowledge and the experience as well. So from the basis, you have all the basic, then you have to move forward complex. Then from the complex, you need to be committed. So at the commitment level, the next anticipate the necessity for what? Making a personal choice after the relative merits of alternatives have been what examined. You need to do that as a nurse, as an in charge nurse. The nurse chooses an action or belief based on what the alternatives identified by the previous level 1, B, and B. So the basic and the complex and the commit, and before you come to the commitment level. So if the chosen action is unnecessary, alternate solutions are considered and choose. These are the levels. So with the stages of cognitive development, where do we cover it start? So we have the stage 1, dualism. So view the world in dichotomous, as the world is what polarized what terms. So you view the world, that is a dichotomous view of the world. Where things are divided into what 2 parts. That is relating to involving or proceeding from dichotomy to the whatever. So you view the world as what divided into what 2 parts. And what is the alternative? So that is where we said dualism. Look to authority figures for the right answers. So if you don't have the right answers, you'll be able to do it, but you think, and if you are not have it, then you look for authority figure who have what the right answer. So the word is what dualism. View the world as what apart, 2 apart. So having what only 2 possible values, yes or no. Is this either this or that, male or female, head or tail, age or whatever. So that is dichotomous dualism. Then stage 2 is multiplicity. You acknowledge that uncertainty or different perspective exists. Yes. Then you believe differences are in effect only until the right answers is discovered by the expert. Stage 3 is relativism, relative ability to form opinions and values based on weighing information in situations. Then stage 4 is commitment level, able to what? Develop your own truth after evaluating information from several sources and integrating this with what is already known. That is the cognitive what. That is why what we develop in our mind. So validity of right answers depends on the situation and the context. Yes. Okay, so divided into two parts, like autonomous. Okay, so these are the stages of cognitive development: dualism, multiplicism, relativism, and commitment. 4 stages in cognitive development. What's next? So development of what? Critical thinking skills. But the stages: 1, dualism, multiplicity, relativism, and so what are some of the specific strategies that promote the development and application of critical thinking? You identify your goals. You need to identify your goals first. So also determine what knowledge is required to do whatever you need to think. You assess the margin for error. If the error is what's going to be more than 90% error, then you don't go to it. Determine the amount of time available for decision making. So these are the strategies that promote the development and application of critical thinking. Identify available resources. Recognize your factors, that is bias or fatigue, that may influence decision making. So what are some of the skills? The skills that we need for critical thinking as nurses. What are some of the skills that we need? You need to have the skills of what? Interpreting things, the skills of what? Analyzing things, skills of what? Influencing, skills of explanation, evaluation, and self-regulation. So how do we have the skills interpreting? You need to be able to what? You categorize, decode sentences, and clarify meanings as it is, as we can say it in the words of the patient. Examine ideas, yes. Identify and analyze what your arguments. Query evidence, yes. So where did I get this? Where does it come from? So you need to more search, get more current data. So the evidence, information, conjecture or alternatives. Then you are also able to what? Draw conclusions.
Sister, please, can you share your screen with us? We can't see anything.
How?
We can't see
Why?
anything.
As I'm sharing the screen,
It's not showing up. Oh.
I'm sharing it. The screen. Okay, let's see. Yeah. So is it now? Hello.
Yes, sister, we can see it now.
Can you see it now?
Yes.
So why didn't you tell me earlier?
I don't know, but I raised my hands several times. You didn't call me.
I didn't see your hands.
But we are just 3.
Ah,
We are just 3 in class, so I don't know.
why
Yes, we are
yes,
just 3.
participants? Why the rest?
I don't know. I
Ah,
don't know. I've waited, but I don't know. I wanted to say something, but
3
I don't know.
participants. I can see 3 participants here.
Yeah.
But it's
Yes.
5:36. And I'm supposed
No,
to
no.
start
I
at
think we are 2 because we are part.
yes, we're supposed to start at 5:15.
Yeah, we were having pharmacology class, but we are done.
Mother.
I don't know why they are still.
But we are saying that
Yes.
you can't use, we can't have time, so you can't eat into somebody's time. It is not that.
Eh,
Yes, we
we are
have
done.
our
I don't
own
know
time.
why they are still not in.
So
We are
when your
done.
time is up, you need to what? Sign
We
out
are
so
done.
that we also come. Just
Sister, we
end
are
your
done.
what? Yeah, you
We
are
are
done. So
done. We are
where are
done.
they? Okay, let's
We are
continue,
done with
Mami.
pharmacology.
So yeah, let's continue because I'm teaching topics today, 2 topics today. I need to finish. Next week we are doing our midterm exams.
Okay, so sister, can you share back those ones that you've taught me?
Don't worry, I'll give you the slide. I am
Okay,
preparing
thank you.
something for you
Okay,
this week.
thank you.
This week, I'm preparing something for you. Don't worry.
Okay,
I'll give it to you. Don't worry.
all right, thank you.
Okay. So I was talking about the critical thinking skills, and I was talking about interpretation. We are as a nurse, we are moving from there. We talked about the level. We've moved from there. We have the basic level where you have to everything when you start school. Then from basic, you need to go to what the more complex things. Then think more complex. When it's easy, it comes to what? And emergency situation, nursing care, whatever, delivering quality nursing care, you need to what? Think from the basics. So, but you can't do that unless you have the experience, the knowledge, the skills, and everything. Then how do we develop the critical thinking skills? As I said, I was saying it was what I talk about interpretation. Mm. I also talk about analyze, able to analyze, examine ideas, identify and analyze what arguments. Then as a nurse, we can also query what your evidences. Where did I get evidence? Did I come by this evidence? Where do I get this the information on all those things? Then conjecture what alternative. That is what you need to what assumption, speculation, inferences on your alternative. Then after that, you can able to what draw conclusion. Even in a situation when it even comes to what patient care, emergency situation, you can think fast. So that is what I'm saying about critical thinking as nurses. You state your results, justify your procedures. Then what procedures did you use to come up with this? Then you present your arguments. You assess your claims, you assess your argument. That is the evaluation. Then self-regulation means what? Simply means your self what examination and self-correction if there's it's necessary. You need to correct something. You need to do something more what's proper. Then that is the self-regulation that you're supposed to do. So these are the critical thinking skills that you're supposed to possess as nurses. These are some of the strategies to build your critical thinking skills as nurses. So strategies to enhance critical thinking. You need to anticipate questions others might ask. Hey, what I'm doing? What if I'm asked this question? What answer am I supposed to do? To give. So this helps to identify what a wider scope questions that need to be what answered to obtain relevant information. For example, what would the family want to know? So you can guess, hey, would the family want to this situation, the family want to know this, the family want to know this. So these are the strategies. So you have your answers. So whatever question that will come your way, you are able to answer it. So ask, hey, what if this question comes up? What answers am I going to do? You think about all these things so that in your field where you are. So look for flaws in thinking for the purpose of what? Evaluating assessment and solutions and making what improvement. So these are some of the strategies. You have all these ahead. So whenever the question comes to you, you are able to what? Answer it very well. So you can also ask what is missing and how could this be made better? Ask yourself. These are the strategy. So asking yourself, you'll be able to answer them before it comes to you. Ask others to look for what flaws in thinking. Then also develop good habits of what inquiry habits. For nurses, now we are doing well, but for first we don't read, we don't do anything. We are there, but now we are doing more research. When something comes to your words, this thing I don't understand. Why won't I research on it? Why won't I get more data? Why won't I get more information? Then on the word, this thing that happened, I don't understand. I don't think it has to be looked into more. So develop good habits of inquiry. Habit that aid in their search for what truth, such as keeping an open mind, clarifying yes information and taking what enough time to think about something. Use phrase such as I need to find out this. Wow, how come this thing didn't go on well? I need to look into more. What is the problem? What is it that's went wrong. So I don't know, or I'm not sure. So use phrases such as what I need to find out rather than what I don't know or I'm not sure. Don't just leave it there. Go ahead and look for more information. 10 errors, whatever errors that you have, turn them into what learning opportunities. It doesn't mean that you are failed. So I'm not doing anything about it. Turn them, look into it more. Turn these errors into what learning opportunities, and you will find your what answers, and you will do well. And these are some of the characteristics of as a critical thinker. You now nurses, we are critical thinkers. So what are some of the characteristics of critical thinkers? We have about 8 of them. Intellectual humility. Yes, intellectual humility. So an awareness of the limits of one's own knowledge and sensitivity of what? Your self-deception. That is intellectual, where you are humble. Intellectual courage. You need to be courageous. So this involves willingness to listen. As I was saying, active listening is very important in our world, as we found out. So active listening and examine all ideas, including those to which there is what a negative what reaction. Intellectual empathy. Imagine oneself. You know, nurses, we always use this word what empathy, rather than what sympathy. So imagine oneself in a place of others in order to what better understand them. So these are some of the characteristics of critical thinker as a nurse. So it allows reasoning from the viewpoint of what others, so that if you feel that, oh, this thing can happen to me. Imagine I am this. Imagine I have situation like this. What will I do? Intellectual what integrity. This is the application of rigorous and consistent standard of what evidence. The standard of care. Follow protocols. Follow standard of care. So intellectual integrity. Do no harm to patients. Treat them very well as you want them to, as you also want somebody to treat you. Intellectual perseverance, the willingness to what continually what seek intellectual insight over a period of time in the face of what difficulties. Faith in reasoning. This reflects confidence in one's own ability to think rationally. Intellectual sense of justice, holding to intellectual the standard without seeking one's what own advantage. Intellectual autonomy, having rational control of one's belief, values, and what inferences. So these are some of the 8 characteristics of what critical thinkers. As you nurses now, you're supposed to be a critical thinker. But other characteristics of we can also, apart from this, we also have other characteristics identified by Afaro. So he also identified these characteristics as critical thinkers. You need to be knowledgeable about biases and beliefs. You need to be confident, patient, and willing to persevere. A good communicator who realizes that mutual exchange is essential to understanding the facts and finding the best solution. You need to be open-minded, listen to other person's view, and without holding judgment until all evidence is weighed. Yes, don't just on the spot weigh judgments. Be patient, open-minded, and holding judgment until all evidence has been found before you judge people. Humble, realizing that no one has all the answers. Yes, you need to be proactive, anticipating problems and acting before they occur. So this is the other characteristic by Alfaro. We also have what? Delphi. Delphi also described ideal critical thinker. So by Delphi definition, who is an ideal critical thinker? Delphi says that the ideal critical thinker is habitually what? Inquisitive, is well-informed, yes, well-informed, trustful of what reason, open-minded, flexible to ideas, change and everything, fair-minded in evaluation, honest in facing personal biases. That is Delphi's description of ideal critical thinker. That is Delphi. So the Delphi report description of ideal critical thinker. Be habitually inquisitive, well-informed, trustful of reason, open-minded, flexible, fair-minded in evaluation, honest in facing personal biases. And so apart from, I said critical thinker and creativity. So there's a difference between critical thinking and creativity. What is creativity? Creativity is like having new what? You are creative, having new what? Ideas, like something like that. So ability to develop and implement new and better what? Solutions. That is creativity, being creative. So when you have critical thinking, you can also be what? Creative. So creative thinking is a process that leads to what? The development of ideas or products that are new or original thing. So that is what? A creativity. So higher levels of thinking require what? A creativity outlook. So when you have what? This skills of what? Critical thinking, then you can also have what? Require also. You can also have what? The skills of what? Creative what? Outlook. So critical thinkers are also what? Creative what? Thinkers. So what is the purpose of what? Creative thinking. What are some of the purpose? So by using both critical and creative thinking abilities, you the next, you narrow the gap between research and what practice. Yes, you can know what this research is. Then how am I going to transfer this research into practice? Yes. So creative nurses think in new ways. Yes, as degree nurses, you can also go to the world back, giving taking what new things altogether, things that are original. Care plan, you develop new care plans, you develop all these new things that are original. That is the duty that you have learned as what? A degree nurse. So don't always follow things. You can also sit down, think about something that is what valuable. That can also help this patient improve what patient outcomes as nurses. So creative nurses think in a new ways when searching for solutions to problems. The process of all creative problem solving is what goal directed, thinking that leads to what achievement by using new ideas or methods. That is creative. So things that are original. Creative thinking helps nurses make what a smooth transition from the old. We the old people, they about say, no, you can't do that. You need to change. You need to what bring new things on board. So as you go, they will be expecting much from you. Oh, so as a beginners, what new thing are you bringing on board to improve this kind of situation here? We are looking forward for you to bring new things, institute new things for us. So what are you bringing on board? So when you go, think about something, do something new in wherever you find yourself in. So creative thinking helps nurses make what a smooth transition from the old to the new by facilitating analysis and what planning. Creative thinking. So I can't remember when I completed from school from Lebanon. So there was so much expectation from me as the goodness. What are you doing? So I was able to what? Also think fast, do something. So I can't remember there was this daughter. So I have seen some new things, new ways of doing things, nurses. Now, do you have a new nurse here? So you look at it. So for nurses, they were not writing too well. So I had to take my time, do a detailed thing. So there was this doctor. Who wrote this kind of English? It's like we have a new doctor here. They said, oh, there's this new nurse who came from Lebanon. I said, yes, because for you old nurses, I know you. You can't do this. You can't do this. So let's them feel your presence. Bring some new things on board. So everything that they want, they will always ask me, what do you think about this? What do you do? How do you go about how you see? Let your presence be felt that you have been what? Have a degree, have something new, bringing new thing on board. And solve the old things. Always think critical and be creative. Then these are some of the behaviors associated with critical thinking and creative thinkers. So critical and creative thinkers engage in what? In the following behavior. You recognize the existence of a problem. That is a stimulus for change. Don't just sit there. You have to there's a problem there. Consider new ways of what? The problem solving, not only about the old ways. Consider new ways of what? Problem solving. You establish what the criteria for assessing the effectiveness of an action. Learn from one's one. Say, because you have to make mistake, but when you make mistake, don't just leave it there. Learn from the mistake and move to the new things, the correct thing. It will help you. Transfer learning from one situation to another. Transfer learning from one situation to another. Create innovative solutions to complex what problems. As graduate nurses, degree nurses. Let them feel your presence. These are some of the blocks, disadvantages towards creative thinkers. A habit. Oh, I had to say, so I don't need to change. No, I said be creative. Irene. Yes,
Sister,
Irene.
please, the slide is not showing, please.
Hey, again.
Hey, nothing is showing.
Ah, no, it
It's
was
just
showing.
the
Then I corrected it. It's still
Yeah,
how?
we are not since I joined. I haven't seen the screen.
No, you are late. So I think you are using the old
No,
one.
no, I'm not. I'm not using the old one.
You are not. You are late. We started with three. So the three
it's
people, can you see them?
the-
Hello.
it's just the topic that we've treated, like the lecture 1, 2, those things that are showing.
Ah, what is that?
The what you are teaching is showing, please.
Ah, let's see. Oh. Um. So I'm share. What is? Oh. Can you see them now? Hello.
Yes,
Yes,
sister, it's
please.
showing.
It's
Is it
showing now.
showing?
Yeah, we
Yes,
can see.
please. It's showing.
We can see
Because we
them
are
now.
not here. Yeah, because you are not here. Because all the three people that started, they can share. So these are some of the blocks towards creative thinking. So habits forming. You change from the old habit towards the new one as you are what you have acquired the critical thinking skills and what creative thinking. So these are the blocks. So the habit. Oh, this place there. This is what we do. We are not. You can't change anything from here. So it's a block. So it's a problem. It's a challenge towards creative thinking. Comfort with the status quo. I had to say, we are not ready what to change. We are not ready to what start a new thing. Fear of making mistakes. You need, oh, these are the status quo. They ask me not to change. If I make mistake, what will happen? And the tradition goes on. Use of meaningless routines and rituals. This is go like this. You don't have to follow the procedure, the policies that we have, the right mindset. So these are some of the blocks that's. What about critical thinking and problem solving? What is problem solving? Problem solving. We are done critical thinking. We are done creative thinking. Then what is problem solving? Problem solving. So problem solving is what? So critical thinking includes what? Problem solving and decision-making process. Problem solving is what? A systematic and scientifically based process that requires the use of what? Many cognitive and psychomotor skills. Problem solving. What are some of the factors that interfere with effective problem solving? Jumping too quickly towards what? A conclusion before exploring all the aspect of what? A problem. Sometimes you read just one sentence, then oh, I have the problem. No. Sometimes in the end, it's not what you are expecting. So jumping too quickly towards what? A conclusion before exploring all the aspect of a problem it can interfere with effective problem solving. Failing to obtain critical facts about either the problem or proposed change can interfere effective problem solving. Selecting problems or changes that are too general, too complex, or poorly defined. Yes, need to be specific. Mm. Failing to what? Articulate a rational solution to the problem or proposed change. So you need to be simple. Then failing to implement and evaluate the proposal appropriately. So it can interfere. Problem solving. So these are the problem solving process. You need to what? Before you solve a problem, you first have to identify the problem first before you can solve it. Then you can go ahead after identifying the problem that you're supposed to work on it. Then you need to get more gather information, detailed information, information-rich material. A specific problem is named. Yeah, so this is the problem. So this is what I'm going to plan for. So you plan for solving the problem when you develop. Then the plan is put into what? Action. Results of the plan are evaluated. You need to evaluate the problem. So with the problem solving, what is decision making? So I've done the critical thinking, creative thinking, problem solving, and decision making. What is decision making? Decision making, what is it? Decision making is what defined as what considering and selecting what interventions from a repertoire of what actions that facilitate the achievement of a desired outcome. That is decision making. So as professional nurses, we use critical thinking to develop and support sound what clinical decision. Yes, that is what we do. We think critically. So make what sound clinical or decision concerning patient care. So safe, effective nursing interventions are implemented only after what? Reflection what? And reasoning. So we have two aspects of what? Critical thinking. So nurses who make sound clinical judgment know what the science and mean and knows what to do about it. So these are the decision-making process. You identify a purpose, you set the criteria, weigh the criteria, seek alternatives, test alternative, you troubleshoot the problem, then evaluate the action. So how we identify the purpose? So what is the purpose? So why is the decision necessary? Okay, this is necessary because of this. So what needs to be determined? You state the issues in broadest what possible terms. Then you set the criteria, what needs to be achieved, what needs to be preserved and avoided by whatever decision is made. So the answers to these questions are the standard by which solution will be evaluated. You rank each criteria on a scale of values from 1, that is totally unimportant, to 2, extremely important. So sometimes you can do the ranking, the scale. List all possible courses of action. So is one alternative more signal than another? Does one alternative have weaknesses in some areas? Can this be overcome? Can two alternatives or features of many alternatives be combined? Okay, then you test your alternative. When you seek alternative, you test it. First, using the same methodology as in step 3. That is where you list all the problems. Rank each alternative on a scale of 1 to 10. Then you second multiply the weight of each criterion by the rating of each alternative. Then you add. You first use the same method as in step 3. Step 3 is 1, 2, 3. You rank each criterion on the scale of values from 1 to 10. Then rank each alternative on a scale of 1. Then second, multiply the weight of each criterion by the rating of each alternatives. That is the testing alternatives. Third, you add the scores and compare the result. You get to know, yes, what decision is best for you to use. What could go wrong? That is the troubleshooting. How can you plan? Can the choice, yes, be improved? Yes. Yes, I'm listening. Is the solution
Hello,
being
good evening, ma'am.
implemented? Yes, good evening. Is it effective? Is it costly? Yes.
Please, our MSM is on at 6 p.m.
Oh, when? Today?
Today, please.
No. It's next week. Oh, let me call
Madam,
you.
it's today. They kept today.
But they say 17th. They kept Friday 17th.
That is when you are supposed to. No, the 17th is the year 4, and they're supposed to send their if anything, the assignments. And not you. Let me check. No. You are not doing the midterm today. It's rather the year 4. They are submitting the assignments on the 17th. That is today.
Oh, then
Yes.
you call him, please, madam.
No, you won't do it. Don't go and do it. Don't attempt. You understand?
Thank you, ma. Thank you, ma.
I'm calling him right now.
Thank you, ma. We're here.
Thank
No,
you.
you're not. It's next week. Not today. Let me see. It's year 4 who are supposed to submit the assignment today by close of today. No, you. But you have submitted the assignment, right? Hello.
Yes, please.
Yes, please.
So you are not doing that the midterm
Yes,
today.
please, ma.
It's next week.
Okay.
Okay. I'm
Thank
calling
you,
you.
ma. Thank you, ma.
Okay. So okay, I'm calling Yusuf to alert him. You are not supposed to do your thing today. Okay. So please don't go there. You understand? Hello.
I've already kept you on the group. No, but yes, ma.
Hi, doctor.
Yes, ma. We will not even go
doctor.
there. We will not even go there. Don't worry.
Don't go there. I will rectify it.
We
I
will
will
not go there.
rectify it. Don't go there.
Madam, you won't go. Thank you, madam.
Yeah. But how can you do it, Mr.
That is even the reason why most people join late.
No. So
Exam phobia.
That's the most reason why people join late.
No. But I've not even told you that you have a midterm. So how can you do a midterm? Guys, I've not told you. No. It's year 4.
The thing was that, doctor, we last discussed about it, and you say you will inform us when you are ready. We didn't get the information, but because we saw it on the virtual class.
Yes, wait. I'll install it. Hello, Yusuf. Year 3 for the say almost by MSM. Next week, year 4 for now. Almost submitting on assignment, no. Almost MSM and let's this. Yeah. Okay. It will be next week. This week is there because I said 17 for no. Almost submitting assignment. Year 4. Hello. Me no she say year 4 for na submitting an assignment no. Now you no. From Monday to Friday. That is the assignment. And I'm can't say me time now. Make a throw for Missem no. No, not Friday we you. Me see Friday we met try again. Not next week Friday no. Now I can't say me time now. Me ready. I mean, part time and then say no. And say yeah, also then na me trauma deal. Nti me ka say me trauma deal and na next week no. Na me say mo. Nti omo fa assignment no ma di. Na akwa so me ready na me dates na me ma say no date. Just see and my friend me say omo say assign nti omo class in pool. I say be class but me say next week never I be me say no ba this way. Nti omo but next week Friday. Pacho close manner. It's next week Friday. It's not year 4 for almost submitting on assignment. No, who submit the assignment and submit MAO. Management, but only na be miss no next week. And year for no regular for no say exams Monday Monday to Wednesday. Let me. Na yahwe nti wako munyina nti anho munyina be no Friday enye ye next week Friday All the close way no near. And so mama says, "Yeah, I'm going to class." Okay, thank you. Hello.
Hello, ma.
Hello.
Hello,
Why
ma.
would you ask me? You could have asked me because I'm not used to cry. I can't say next week. So why would it was this week? Make my mama cry. Okay. Okay. So let's we are closing it. Okay. So it's next week.
And thank you, ma.
Okay,
That's even the reason why most of our clothes join late for the class.
What were you doing?
We're preparing.
I said that's the reason why, but they were just glancing through their slides. That was the reason why they thought the class wouldn't come today.
You could have asked me because I've not told you for any Miss. So why so I'm Miss then I'm teaching. No.
And then we are afraid.
Oh, so
No, it's not possible.
Some of us were even consulting the girls.
How? No, I can't. No, I can't do that. I can't do that.
I was even surprised when they said it's class, and I was like, we have midterm, so there's class. Well, sister, thank you very much for clearing things up for us.
Okay. Hello.
Hello, madam.
We are with you.
yes, ma.
Okay. Can you see?
Yes, it's showing.
Okay. So now decision making and problem solving. So although decision making and problem solving they appear similar, but they are not what synonymous. No. Decision making may or may not involve a problem, but it always involves selecting one of several alternatives. Then each of which may be appropriate under certain circumstances. Then problem solving, on the other hand, involves diagnosing a problem and solving it. You diagnose a problem and solve it, which may or may not entail decision on one correct solutions. So most of the time, decision making is a subset of a problem solving. However, some decisions are not of a problem solving nature, such as decision about scheduling, equipment, in services. It's not a problem solving nature. That's decision making. Okay, so we are done with decision making, critical thinking, decision making, and problem solving and creative thinking. Let's go to counseling. In earlier on, we are not here. I told them we are dealing with two topics today. Decision making, problem solving, creative thinking, and what?
Bernard, your distance your mic is on, Bernard.
So now let's move to counseling. So with our counseling, so next week you have more time to go through your museum, okay? So next week I don't want to teach. I will have to go do your museum. So let's quickly go through counseling and see. Okay, counseling. Counseling. Counseling, what is it? Nurses, as nurses, we also what some form of what we so do some form of what counseling. Can you see? Hello.
No, please.
Yes,
No,
please. We can.
please.
Yeah, nothing is showing.
That is
Nothing is showing.
okay. Hello.
Hello, doctor.
Yes.
Okay, dog.
So nothing is showing.
Yes,
It's just
please.
nothing is
No,
showing.
please.
Just
It's your file explorer that is showing, not the
this
slide.
thing.
Okay. I saw.
Please, it's showing now.
Okay.
Doctor, please, it's showing.
Okay. So counseling. Counseling. So as nurses, you've been also doing some form of what counseling on the watch. Okay. So what is counseling? Counseling. So counseling denotes what? Giving advice. Giving advice. And it's a specialized what? Service of what? Guidance. No, counseling is what? Is a process designed to help an individual grow to greater maturity through learning and to make decisions of what? An individual. So that is counseling. So what is counseling? This is my very introduction. What is counseling? What is it? Counseling is a way of working within people in which you try to what? Understand how they feel and help them to decide what they think is best to do in their situation. That is counseling. So you have various definitions. It's a method that helps the client to use what? A problem-solving process. We have done problem solving now. Okay. Because most of you were not here when we did the problem solving. To recognize and manage stress, and that facilitates interpersonal relationships among clients, the family, and healthcare team. It can also be said that what? An interaction in which what? A counselor offers another person the time, attention, information, and respect. That is what? Necessary to help him or her use the information to make what? A choice or solve a problem. We've also done what? Problem solving. And then who is a counselor? Who is a counselor? Is a person trained to give guidance of a personal or psychological problems. So a counselor helps clients identify goals and potential solutions to problem, which causes what? Emotional timber. They seek to improve communication and coping skills, and they strengthen what? Self-esteem. When we have low self-esteem, we can strengthen you. Promotes behavior change and optimal mental health. So you know what some people what would need why we see for counseling. So what is the aim? Let's see. What is the aim? The aim is to help individuals to understand themselves in terms of ability, their interest, motivation, and potential. We don't seek counseling when we also have only a problem. When you want to decide on something to we also seek counseling, gain insight related to emotional difficulties. Then after more adaptive behavior, that is, more adaptive behavior is what is used to describe what? The types of behaviors that inhibit your ability to adjust to situations. That is more adaptive behavior. Types of behaviors that inhibit your ability to adjust to situations. So the aim is to achieve integration and fulfill what? Their potentials. Why do we do counseling? Indications. People who have what? Mental conditions, they seek what? Counseling. So mental conditions such as depression, anxiety, eating disorder, alcohol, whatever, they seek counseling. People with an upsetting physical health conditions such as what? Infertility. Fertility, yes. They seek counseling. Yes. A difficult life event such as what? Bereavement, a relationship breakdown, or a work-related what? Some stress. Sometimes, oh, this work is too much. My child is not happy with whatever I do. So you are frustrated at work. You can seek counseling. Difficult emotions, example, low self-esteem or anger. You can seek counseling, and other issues such as what? Sexual identity, sexual abuse, and all those things. You can seek counseling. So this is the indication. But you know, there's an ethical issues involving what? Counseling. And you know what ethics are? They are do's and don'ts of what? Of a profession. That is ethics. So as I said, they are the agreed standard of code governing what? A profession. So in everything, every profession, we have our ethics involved. Even nursing and ethics, we have nursing ethics and all those things. So every profession, such as teaching, law, medicine, nursing, has its own what? Ethics. They are general universal, but you know, in the ethics, they are general universal what? We have some specific things that we nurses are supposed to do, but generally, there is what? A universal guidelines to which every counselor is expected to what? Conform. So number one is what? Confidentiality and its limits. So in Ghana, the counseling profession is still young and does not what have specific code of conduct like the nursing profession. You understand? But there are general universal guidelines to which every counselor is expected to conform. So confidentiality and its limits. So counselors need to develop trusting what relationships and an understanding of confidentiality in communications and discussions helps build what? That's trust. So confidentiality is very important. You keep what? A professional distance. Counselors' relationship with clients should what? Always remain within what? The context of the counselor's what? Professional abilities, not something else. So the burden is on counselors to act what? Professionally and ethically. Romantic relationships with clients are serious breach of what? Ethical standards. You only need to maintain the highest standard in the series of it. Whatever you are offering, maintain a higher standard. That is where you're supposed to be knowledgeable, competent, and efficient. So as I said, they are encouraged to constantly update their skills through conferences, as nurses do, workshops, and sharing experience with their senior colleagues. That is counseling. Respect differences in cultural values and traditions. Counselors need to be aware of their own cultural biases and values to avoid imposing them on their clients. They should develop an understanding of how social and economic inequalities, as well as gender, cultural, and racial biases impact on clients' abilities and their families. And be aware of what? Dual. Oh, what before? It wasn't here. That's what lost it. This isn't finding. This is a room. This is the nothing. Oh, we take my phone. Hello.
Hi,
So
hi.
Hello.
okay. Be aware of dual relationship. So counselors should be what? Mindful of what? Relationships that could what? Compromise their objectivity and what? Impair their ability to self fairly. So such as what? Counseling children of what? Close friends. Or romantic what? Partners. You should be aware when you are doing that. Sometimes see even doctors when gynecologists when their wives want to what whatever they refer them to what another doctor. They didn't want to what have anything to do with them. So if a relationship are unavoidable, counselors should take what extra steps to what to maintain their objectivity, documenting their work or even agreeing to supervision. So there are two examples of the extras the counselor may take. Then the counselor must believe in human the dignity. It's very important. Dignity. Human dignity. Wait. Yeah. Thank you. You was my sister. Because So the counselor must believe in human dignity. Believe in human dignity implies that the counselor should be accepted for what he or she is, the counselor. So the counselor should be non-judgmental to allow counselees to have confidence in themselves and the ability to cope. So these leaders they lead to greater courage and self-assurance in taking the problems. We should show also regard to the social codes and moral expectation of the community. As a counselor, the counselor's respectability and acceptance by the community is closely related to how well he or she conform to the norms and moral codes of the community. For example, Christian counselor living in Muslim communities should not look down on Islamic religion and practices. That is what I mean by social codes and moral expectations of the community. So we have the principles of counseling: principle of acceptance, respect for an individual, principle of thinking with an individual, permissiveness, learning, and consistency. So what are some of the characteristics of an effective counselor? You as a counselor, you need to be well organized within your practice. Yes. As nurses, we are also knowledgeable in our profession. Practice ethically and professionally. Educate yourself as you are doing. So you are now moving from diploma to degree. I expect you that after this, you can also move further. Don't just be there. Move further. It will help. So educate yourself. Be confident in your position and responsibility wherever you are. You find yourself as a counselor. Be respectful and non-judgmental. Understand the importance of communication. We have done in communication. We have done all aspects of communication. The styles, the skills, and all those aspects. Have flexible attitude. So what are some of the qualities? As a quality, you have to be skillful in communication. You need to be acceptance. So the counselor must have the ability to relate to clients with an open, non-judgmental attitude. So acceptance means accepting the client for who he or she is, and in his or her current situation. So we need to accept them, irrespective of the political affiliation, economic, whatever. Accept the client for who he or she is. Counselors need to be able to convey acceptance to their clients with warm and understanding. Empathy. Always talk about empathy. Nursing, we emphasize empathy. Counselors help people through some of the most okay. So as I was saying, we also have to get the problem solving qualities of what? Problem solving. I've talked about problem solving in the first lecture. So counselors must be able to what? Help clients identify and make changes to negative thoughts, patterns, and other harmful behaviors. That might be what? Contributing to their issues. Rapport building. Counselors must possess a strong set of what? Interpersonal skills to help establish rapport quickly with clients and develop strong relationships. Then they should be flexible, the ability to adapt and change the way you respond to meet your client's needs. So being flexible is one of the most important attributes of what? A professional counselor. You don't stay rigid and stick to predetermined treatment path when your client requires what? A different what approach. So that is what is flexibility. Self-awareness, multiple cultural competencies, it is the ability to look within and identify your own unmet psychological needs and desires to be professional competent. So this prevents your issues from what? Affecting, conflicting with those of your what? Clients. Counselors help people from all walks of life. So it means trying to relate to and understand your clients regardless of their race. So multiple cultural competence, ethics, ethnicity, religious or political beliefs, or socioeconomic background. And we have other qualities apart from this that I've mentioned. So apart from being having communication skills, being acceptant, empathy, problem solving skills, qualities of problem solving, rapport building, and flexibility, being flexible, self-awareness, and what? Multiple cultural competence. There's other attributes of a counselor apart from this that I've mentioned. Self-awareness, we have done that, open-minded. Okay, so these are some of the types of conflicts that we have. Types of conflicts. We have short-term counseling. I said conflict. Counseling. So short-term counseling, long-term counseling, and motivational interview. So what is short-term? And it focuses on the immediate, that is short-term, immediate problem or concern of the patient or family. So short-term therapy is often what? It defined as what? 12 sessions or less. That is short-term, it's short-lived. Often short-term therapy is appropriate for people with what? Situational problems, such as what? Stress management, conflict at work, communication problems, relationship issues, parenting. So this is means for what? Short-term counseling. And as I said, it's often defined as what? 12 sessions or less. Provide the opportunity to set up what? A therapeutic relationship and interaction needed to what? Hello?
Hello, madam.
My internet is not stable at all. This one is disturbing me. Okay, let's do it quickly. My internet is not stable. Hello. Yes, good evening. Please, I'm teaching. Okay. Motivational interview. So this is an evidence-based counseling approach that involves what? Discussing feelings and incentives with the patients. So in motivational interview, it is a counseling method that help people resolve ambivalent feelings. So ambivalent, that is undecided feelings or unsure when they are not sure about their feelings and insecurities to find the internal motivation they need to change their behavior. So it is a practical, empathetic, and short-term process that takes into consideration how difficult it is to make life changes. So that is what when people are not sure. That is motivational what interviewing. So these are the steps, and you also know that the steps, the gather acronym. Mm. So in knowing the steps of counseling, always keep it the acronym, the gather acronym of all head of it. I know that you ask clients about what themselves and the problem affecting them. That's eliciting the need for what clients and prioritizing their needs. Mm. Then you tell clients or give the information of strategies, coping mechanism. Mm. Please. H means what? Help client to make a choice. E, explain the preferred choice that made, that is the strength and limitations. Then return for follow-up. So if you want to interview clients, who's for what? Collecting information from the client. Can use interviewing. It's a tool for collecting data or information. You can also do observational what studies, anecdotal what records. You can use anecdotal records that are not readily available. You can also use cumulative records. So the anecdotal, that is the records that are what? Hearsay, circumstantial, or subjective. Unreliable. You can use that one. Problem or interest, the checklist. You can use rating scale, sociometry. That is the sociologists use that. Then you can also use psychological tests. These are the approaches of counseling. You have directive counseling. So with the directive, we have non-directive counseling. We also have elective counseling. These are the approaches. Directive, non-directive, and elective counseling. What is directive counseling? Then is a process of listening to a member's their problems and deciding with the member what should be done, and then encouraging and motivating the person to do it. That's directive. So this one, it is what? A counselor-centered counseling, because the counselor is directing the counseling. So it was a counselor-centered counseling because it allows for the counselor to give the counseling information. So the counselor is giving the counseling more information. So he is active active participating in the counseling process, the approach. So he is going to set all the information and give it to the client. So it's what counselor-centered. So this type of counseling is more useful when the individual wants what? Information, yes, and advice for choice of what, maybe a career, husband, or all those things. So this approach does not focus its attention on the personality development, no. But you are searching for information that will help the counseling. But the other one, but let's go through this first. And you know that the directive, we have 5 steps in performing the directive counseling. You need to do clinical analysis first. So you need to do clinical analysis. So 5 steps in performing the directive counseling. You need to diagnose the problem. So you formulate first, clinical analysis, that like collecting information, assessment, summarizing or organizing data. That is clinical analysis. Then the diagnosis is what? Formulating hypothesis as the cause of or causes of what? The problem. Then prognosis, you predict the development of the problem. Then you start with the counseling. So the heart of the process wherein the counselor and the counselee talk and discuss the problem, and by means of what? Leading questions and answers, this enables the counselor to develop what? Insight into the present problems. Then you also need to follow up, helping the clients with recurring or what? New problems. So that is the steps. And with a non-directive, it's more of what? Client-centered. We leave it to the clients for client to search for his or her own information. So in non-directive counseling, in which the counselor is empathetic, put yourself in there, you feel for the patient, and that's not what evaluate or direct clients' remarks. That's assisting them to accept their responsibilities for their own problem solving. Yes. In this counseling, the client has to be led to a point of what? Where you need to what? Realize that you have to help yourself. So realization of what? Self-help. Information may be used to classify a choice and to implement a decision. So this type of counseling is regarded as what? Client-centered, because the responsibility is given to the client for exploring their own problem. So these are the difference between directive and non-directive counseling. That's simple. Hey, please, you are disturbing. So this is the difference between directive and non-directive. So directive and non-directive is economical. And the non-directive is what? Time consuming. So you have the client to search for his or her own information and realize a change. So if you're an alcoholic, we ask you to what? Help yourself. So you will take what? Active participation. You emphasize on what? The problem, emphasize on the individual behavioral change. Explain on intellect, explain on what? Emotional aspect. You solve immediate problem, deal with what? Self-analysis and new what? Problems of what? Adjustments. Using psychological assessment may or may not use what? Psychological assessments. Counselor plays active role. This one, counselor plays what? Passive role. Counselor helps in decision making. Client's own decision. Rapport forming is not significant, and this one is very important and essential. And the third aspect is what? Elective counseling, neither here nor there. So the two of them combined. So as the synthesis and combination of what? Directive and non-directive what? Counseling. So it represents a middle status of what? Between the two extremes, represented by what? Non-directive technique on one hand, and the directive techniques on the other hand. Yes. So the counselor is neither too active as in the directive, nor too passive as in the non-directive. Okay. So they have other types, other approaches, psychological and all those things, group counseling, behavioral, educational, and all those things. But when we are doing the counseling, apart from the approaches that we have, we also have the stages in which the counseling has reached. So the stages in the counseling, the process that we are going, we also need what? Stages. So for counseling to be successful, both the clients and the counselor need to be to comprehend, to understand what the change stage they are in. Yes, when we are going through the process. So we have about 6 stages of change in counseling, and each one having an importance in allowing each and every one of us to move from the unpleasant to the pleasant state of living. That's the happy life. So what is stage 1? Contemplating. Stage 1, pre-contemplating. You are contemplating that before you go to contemplating, it's pray before. So stage 1 is pre-contemplation. This stage is characterized by what? 2 distinct elements. First element is what? The person not being able to see or understand what the problem is. So you don't care. So you not even read the contemplating stage where you want to go to counseling or not. You don't even know the problem or understand what the problem is. So you don't care about. counseling, but it is coming. So we have the first is that's then the clients wanting some other person to change. That's the problem is them and not me. You see that there's a problem, but you don't want to change. So you think that the problem is not biased, is for you. So with the pre-contemplators usually come to counseling because of some form of what, some pressure from another person. So you think you need this time. So spouse, I'm not ready, but people are what, putting pressure on me to come for this. So I'm not ready. So there may be some pressure from another person, like their spouse, their employee. Their employees have seen that you have this, but no, they are not prepared or ready to do that. Call the school, whatever. So concurrent pre-contemplators also resist change, and therefore employee denial, what, minimization tactics. They play tactics to disown any responsibility for their contribution to the issue at hand. What about stage 2, contemplation? Contemplation, where this is characterized by what, the client wanting to better understand. So I am thinking that I have to better understand. I have this problem. So I am thinking that I should do this. So it is what, contemplating. So what the bump of what is the issue is. So by the client wanting to better understand what's the bump in the road, that is what the problem is about. So to see the causes and as well as to explore what options are available to resolve the issue. So the key point to remember here is that even though a person may know what the issue is and what needs to be changed, contemplators are not quite yet ready, yes, as in the first one, to make a commitment to action. What about the third stage, preparation in the counseling process? So this stage is what characterized by the client going through additional areas of what? The mindfulness areas. So learning and growth. Sometimes the client needs to what, improve their communication skills. So that's the preparation that you need to solve a problem. Maybe sometimes it's what, career goals. So you are preparing how to a choice in your career. Parenting behaviors, intimacy practices, and further strengthen their self-esteem. So in this preparation, say they are preparing for all this. They are preparing their mind for these things, for growth and learning and learn. So in particular, we use this stage as an opportunity to identify the client's values and supporting behaviors in 4 key areas of life. Redefining themselves, self-development, your work, and relationships. So the primary goal here is to what, actualize individual awareness so that a sense of self-control, comfort, and security are present when the client goes from preparation to action stage. So with the stage, we are preparing the mind. So that's the mindfulness in areas of what? Learning and growth. Then the action stage is the 4th stage. So the common problem here is that most clients and counselors believe that their change means what? Action. Action now at the onset of what? Counseling. So, however, if the first 3 stages of change are not properly addressed in counseling, you cannot go to the action stage. So failure in counseling and or after counseling can occur. In fact, over 45% of all clients stop counseling before the 3rd stage, as they feel their therapist or family wants action before they are actually ready for what action. So once the action stage in counseling has allowed us to change our thoughts, then can we commence with the more visible desired actions, behaviors, and feelings in and outside counseling. That is the maintenance stage. The maintenance stage, where this is characterized by the counselor and clients to identify what possible trigger points or other factual issues exist in the work and social family setting that could cause a relapse. So that's the maintenance. So when you have taken an action, you need to maintain it. So for instance, whether a client is coming in to quit smoking or improve his communication, that's the mindfulness at work or in the marriage, the counselor and the clients in this stage shall develop what? A strong commitment. Yes, you need to maintain it. So to establish positive reinforcement activities. But you know, change never ends in what? In the action state. It merely takes what? A new form and presence in our life. Okay, so the aftercare. So when you have maintained it, try to maintain it. What will be the aftercare? So there are some thoughts, behavior, or feelings we wish never return. So after that, we have maintained whatever thing that we want to maintain, achieve. We feel that we never want to return to the old habits. So in short, this state is what? Characterized by determining what type of behavior, the thought or feelings can realistically be what? Terminated. I want to quit alcohol. I want to quit this marriage. I want to do this. I want to do this. And I feel that when I do it, it will never return. But sometimes withdrawal stage, aftercare, it will can come, especially with the alcohol. And so the ultimate goal, though, in the aftercare stage is to ensure that the client understands that by embracing lifelong learning, he or she increases the chance for a more healthier and happy life. So we believe that the lifelong learning process can be experienced both in counseling and other environments. So in short, adults are always open for tune-ups and new learning sessions. So after that, you can always come for us. That is, it's like follow-up issues. And these are some of the theories in counseling. We have decision-making theory, rational emotive behavioral theory, client-centered theory, and cognitive theories. And the decision-making theory deals with how the individual who is we have done decision-making, confronted with many important alternative decisions in life, is able to make meaningful choices that may have great impact in his or her life future. That is decision-making theories. So effective counselors do not aim merely to solve their clients' problems. They rather aim at helping clients acquire the necessary skills that will enable them to solve their own problems. So we are done about decision making and problem solving. So the counselor must help the client select the best alternative by himself or herself. That decision making. So the counselor must not choose for the client. The counseling must be very active and do most of the work involved at each stage of the counseling process. We also have the person-centered therapists. We have always done that. They are concerned about understanding the client's experience and communicating their understanding to the client so that an atmosphere of trust can be developed. So clients are given responsibility for making positive change in their lives. Behavioral theory, it emphasizes on the precision and detail in evaluating it's a psychological, emotional concerns, and then assigning treatment methods that may include, we can have relaxation techniques, copying techniques, behavior, role playing. We have a whole lot of behavioral theories, music theory, relaxation, a lot of them there. Then the cognitive, this one is use a structured method to help their clients understand their own belief system, the mind. So by asking clients to record dysfunctional thoughts, so use your mind in this therapy, and using questionnaire to determine a more adaptive thinking. We have a more adaptive behaviors, group of behaviors. So cognitive therapists are then able to make use of a wide variety of techniques to change beliefs that interfere with successful function of your brain. So they also make use of affective and behavioral strategies. So what are some of the importance of counseling? It helps improve better health outcomes. It improves interpersonal relationship between the client and the counselor. It helps improve the confidence of the counselor and counseling. It helps the counselor to make a better choice. It builds trust between the counselor and the counseling. That is counseling. Do you have any question? Counseling.
Hello.
Yes. I'm listening. I'm listening.
Yeah, doctor, please. My network wasn't good. Can you go back again for me?
Go back to the west. Where? Everything.
Not everything. Please, not everything, but
please. You know, I'm tired. Okay.
a few slides that you.
Me too. I'm also having but I've tried. So if you say that I should go back, this is not fair. Anyway, I'm trying to prepare something for you so that you can have it. Don't worry.
Okay. Thank you very much.
Okay, you're welcome. I'm trying to prepare something for you, okay? Don't worry. So by the end of, let's say tomorrow, Saturday, I'll send you the slides.
Okay, doctor.
So that you can learn. So next week, I think we'll end. Let's see. Next week we'll go for the listen. So try and do well, okay?
Okay, doctor.
Okay, so I'll see you next week.
Okay, thank you.
Thank you very much.
You're welcome.
Okay, bye.
Bye-bye.